Hi, everyone. This is Sarah Russell, and I'm a nutritional therapy practitioner. And this is part of a series of brief videos that I'm putting together specifically based on conversations that I've had with people that I mentor in my practice regarding, um, you know, questions that come up very frequently. So one of these is, which lab tests should I learn how to interpret for my holistic health or functional nutrition practice? Um, I will say in advance that some of what I'm going to say might actually surprise you. And I'm very much open to any questions or comments that you have and any experiences that you want to share, because this is not a straightforward um, topic. And I also realize that, that there isn't any room for dogma or absolutes. So please take everything that I say, as experience-based opinion, but not an absolute. And I'm totally open to having a conversation based on those premises. So there are a few things that I'm going to cover in the attempt to answer this question as fully as possible in the scope of a brief video. So the first thing I'm going to say is that the perspective that I advocate is always having a client-centered and service-oriented practice, and that all of the advice that you will hear me give is based on the assumption that that is going to be a win-win both for you and for your clients. I am a firm believer in the fact that long-term prosperity is going to be much better than short-term profit. Again, if you want to just, if your goal is to make a profit, to make a lot of money fast, this is not the industry to be in, quite honestly. I mean, there are people who are doing an amazing job with sales in our industry, but they're not serving. It's just very, very different. So the next concept that is important to get straight is that when we're working with people in holistic health or nutritional therapy from a client-centered and service-oriented perspective, we are in the line of work of solving problems. We are not in the line of work of selling people lab tests, or even selling ourselves as experts in this or that lab test. And we don't have to be the be all and end all as practitioners. It is not all about us. So again, let's get back to that client-centered perspective. And that means decentering the attention from the practitioner as expert, from the practitioner at the center of everything, as the beginning and the end of the client health journey. So what I advocate is using any functional testing that you may become certified in as tools in the process of an integral client healing journey, where you and the client are working together, sometimes in the context of a larger framework of people who are collaborating. So for example, you may have a small network of practitioners that are rallied around your client. So you don't have to do it all, you don't have to be it all, and you don't have to know it all. And that is really, really good news for everybody. And that being said, there may still be some labs that you will want to learn how to interpret and offer in your practice as part of a service-oriented and client-centered offering that you have to provide. I do use some functional lab testing in my practice, and I'm glad that I did, but I also am very glad that I went ahead and opened my nutritional therapy practice before learning how to interpret any lab tests, because that really helped me get started from a foundational perspective, working with whole foods and really listening deeply to the client's history, to their family history, to their current signs and symptoms, and paying attention to how they're currently eating. These are really important details that we can sometimes forget. Like, the more sophisticated we get as practitioners, the less we pay attention to, like, macro issues from the person's daily life. So you could be incredibly sophisticated at interpreting, I don't know, salivary adrenal panels. And you can do that and be a gifted practitioner at the same time. I'm not in any way diminishing that, but if you are a practitioner who is incredibly gifted at reading salivary adrenal panels and you are not paying attention to how much water your client is drinking, how much they're eating, if they're over exercising, or maybe not moving enough, or eating too much sugar, or missing some really important nutrients, or did I say not sleeping enough? Not sleeping enough, or living in a really stressful situation. I mean, these things are so foundational. So first things first, you can be a totally adequate and confident practitioner without offering advanced labs in your practice. Pay attention to what your clients need. What problems are your clients trying to solve? Versus, what do I want to offer? How do I want to sell myself? Like, take yourself out of the center of your work, because you are not the center of your work. So I know that might be a little bit controversial to say it this way, because we are so, we're so steeped in a world where it's all about, sell yourself, market yourself, position yourself, this and that. Yes, do all of those things, but please serve, because it's completely useless to market and sell yourself and be glamorous and, Instagrammable if you're not providing a high quality service that you can ultimately, at the end of the day, feel that is, that you're truly helping people along their healing journeys from the perspective of collaborating with them and maybe other practitioners to solve their problem, as opposed to make yourself look great. Because it just really is not about us. It really, really isn't. What is going to help sell your services is your client's healing. It is the experience that they have in working with you. Did you help them solve their health problem? Have they gotten better? It does not matter if you learned how to interpret salivary adrenal panels or not. At the end of the day, your client does not care about that. They care if they solved their health problem. Did they get better? Are they sleeping through the night when, if they came to you for insomnia? Or has their autoimmune illness gone into remission, if that's what they came to you for support for? Did they get pregnant? If they came to you struggling with infertility, that's what matters. It is not about the testing. The testing is secondary. It's a tool. It is not anything else. So how did I select the specific tests that I'm using in my nutritional therapy practice? First of all, one surprising thing happened to me. I thought that I was going to serve a very specific niche. And then I ended up with with a couple of overlapping niches. Sometimes they overlap and sometimes they don't. So I thought that I was going to specifically serve clients during preconception, during pregnancy, and during postpartum. And then I ended up with a more diverse clientele. I ended up during the first 2 years of my practice attracting a lot of clients who had complex health problems. And yes, I mean, I have developed a core of clients that come to me for support during the family building years. But that is not mainly what I've been doing. So that's really interesting. So that, again, goes back to the client-centeredness of it all. You may think that your identity as a professional is a certain thing, but then if people repeatedly come to you for something else and you become really, really good at it and you love it, then your professional identity is dynamic and transformed as a result of your coming into contact with people who have specific problems that they need help with. So what sort of support did my clients need? They needed me to know about mineral imbalances, heavy metal toxicity. They needed me to know about, the basics about mold illness, the basics about immune balance. Of course, all the foundations, including digestion, sleep, hydration, proper nutrient intake, absorption, all of that. and also, the basics of healthy movement. Um, Only some of these things are lab dependent. So the first functional lab test that I learned how to interpret was the hair tissue mineral analysis, because I had a need in my practice to support people with histories of mercury, lead, and cadmium toxicity and other heavy metal exposures, people with osteoporosis and other issues that relate to mineral imbalances. And I really wanted to individualize my work. So I specifically studied hair tissue mineral analysis because it was a tool that some of my clients needed in order to get better. Beyond the foundational work that we were doing together when I first started working in my practice. I do not leverage myself as a hair tissue mineral analysis expert. It is just a tool that I have at the disposal of clients in whose best interest it may be to incorporate that in our work together. It is all about my client. It is not about me and the tests that I know how to interpret. Um, I have also learned how to interpret blood chemistry panels from a functional perspective. So I know how to read between the lines of the normal routine lab tests that doctors will order for their patients. I look at at the complete blood count, at the comprehensive metabolic panel, lipid panels, and various other tests, basic, serum hormone panels, specific nutrient panels. I sometimes like looking at, especially, in my preconception, pregnancy and postpartum work, I really do like to look at certain specific nutrients that are key in supporting the mother and baby. So for example, folate, B12, vitamin A, vitamin D, some of those other key nutrients. When I'm working with somebody who has a heavy metal exposure, I often will want to look at their red blood cell magnesium levels, their blood zinc and copper levels as companion nutrients, the hair tissue levels, because levels of minerals do not tell you the whole story all the time. Sometimes you need more information. Additionally, I have also learned how to interpret the urinary metabolites of specific hormones. So, adrenal and sex hormone metabolites through the Dutch testing, and also organic acids tests and basic mycotoxin tests. So I have collaborated extensively with functional medicine practitioners. These are sometimes, acupuncturists, sometimes they're MDs, sometimes they are functional medicine doctors, sometimes I'll be naturopathic doctors. And so I don't always have the pressure of having to be the only practitioner who is literate in interpreting these tests. And I really do enjoy working together with other practitioners who are looking at the same tests I'm looking at, and we're each looking at them through the experience of what we've learned and the clinical experience that we've had with people struggling. So, the less you have to be the one and only practitioner, the one and only expert, et cetera, the better for everybody, because your client is getting more perspectives. And it's not, their healing has nothing to do with whether they have a practitioner who is the top dog in the field. It is more about, is somebody listening to me and understanding what's happening? Like, does somebody care? Do I matter? Like, those are so much more important than, the initials behind your name or the specific certifications you may have. I'm going to give you an example of an area where I believe that, and I know this is going to be very controversial and it may take a lot of people off who are watching this, so my apologies in advance, but let's talk. Like I said, this is not about dogma. So one area of functional testing that I think is actually a drawback to have knowledge and expertise in this particular functional testing area, where it's actually better not to have a specific training, is food sensitivity testing. By and large, for almost all of our clients, The gold standard is going to be elimination and reintroduction of foods. This is how we individualize care to clients. There are so many different types of food allergy and intolerance testing out there, and they all have um, really very disappointingly high rates of false negatives and false positives. So you could, um, you might miss a really important thing to eliminate, or you could take out way too many foods than the client needs you to take out. They could end up on a very restrictive diet, and they could actually end up, unfortunately, with more food restrictions than they originally had because they lose oral tolerance. So the gold standard is elimination and reintroduction. Um, I know how to read the food intolerance panels because I've worked with a lot of clients who have done these, and I've studied them, but I really find them to be of limited value, and sometimes I see them actually being a hindrance in the client's healing journey. So um, I understand that there are a lot of people who have specific types of food intolerance testing that they really believe in, that they recommend very widely, et cetera. Sometimes those can be really useful. There are some cases where a person, can really benefit from cross-reactivity testing if they're having, a flare-up in an autoimmune disease, and you just don't, you can't pinpoint what it is that's keeping their immune system struggling so much. And, it's not always a food. A lot of the time it will be an environmental exposure. Mold exposure can really sensitize the immune system a lot. So, but sometimes it is a food cross-reactivity. So that can happen. It is not the first place that I would look. It is almost the last place that I would look. So really start with the basics. Listen to your client. Ask yourself, what problems does my client need me to help them solve? And who else can we bring into the picture to help the client solve the problem? It is not always about you. Sometimes the best service you will be able to give a prospective client is to refer them out to somebody else. If you are not the best person to help them, it is not just about you selling a service or selling yourself. It is really about us guiding people in their healing journeys with the greatest level of integrity that we can give them as a practitioner. So sometimes that means, someone comes to you and you're not the right person, you will help them find the right person for them. And you will become part of a referral network where people will send you your ideal clients. And you will send other people their ideal clients. And that means all the clients who reach out to all the practitioners will be directed to the right person to help them in their healing journey. I mean, isn't that amazing? It's great for everybody because it helps all the practitioners who are doing that fine-tuned referral process. It will help each of those people build a reputation for being really, really good at doing what they do. That means that we don't have to become experts in all the things. It means that we can become really, really good at serving certain types of clients really, really well. And that also means that if that type of client that is coming to us and that we're helping a lot, if that type of client needs you to learn a specific type of lab interpretation, you will understand that. It will come to you. So it's not so much about you looking for the labs that you can then, say, oh, I'm an expert in this or I'm an expert in that. It is more about, okay, what are the needs of the clients that I want to help and that are coming to me for support? What do they need me to know that I don't know yet? And sometimes you don't even have to have that pressure of knowing it and learning it yourself. Sometimes you really can just team up with somebody who knows those things and you can slowly learn them as you go. Again, the less you center yourself as a practitioner, the more you will be able to serve people and the better reputation you will have as a healer. The best gift that you can give your client is to put them at the center, is to put the service at the heart of your work with integrity and dedication. And that is where long-term prosperity comes from. It is not always fast and easy when you're getting started as a practitioner, but I could not be happier about the way that I work. And I'm really, really, just looking back at the years that I've been functional nutritional therapy. I started I started working with clients in early 2013. So this is my uh, eighth year, or I've almost completed my eighth year in practice. And I have to say that I truly have no regrets about always working in integrity to the best of my ability. Have I always done everything exactly right? Definitely not. Gosh, I've made a lot of mistakes, but I'm really glad that I started when I did. I'm glad that that was a time when I didn't have, any specific expertise in interpreting lab tests. I had curiosity, I had interest, but I built my clientele first and found out what they needed me to know, and then I also collaborated with a lot of practitioners who knew things that I didn't know, and that I still don't know, and that's totally fine. It really is fine. The humility that we bring to the table as practitioners who know that we don't know everything, and and uh, and that it's totally okay to not know everything, and the energy that we save from not having to pretend that we know everything and that we are the ultimate experts in everything. I mean, just like how good it feels to say, I don't know. But I know somebody who probably does. Or, let me do some research. Let me find that out for you. Let me connect you with somebody who can answer that question. That's great. It I've been a patient in a in situations where I have a complicated health issue that I've seen a lot of doctors scratch their head and going, oh my gosh, I have no idea what to do with you. um, but what matters is not is not whether they know what's going on with me or not. It is whether they care or not. It is what next step they take. It is whether they take the time to find out who their colleague, which colleague among their in their network might be able to help me. Or, they maybe do some research and they find something out that they didn't know before. I have an amazing physical therapist who literally knew nothing about the condition that I came to him for help with. He's the only person who has an office in my town in physical therapy. And um, the first time I talked to him, he said, I literally have no idea uh, about your condition, and I don't know if I can help you, but if you want to set up an initial free consultation, I'll assess you and we can talk, and you can let me know if you feel comfortable working with me or not. And he's been just the most gifted physical therapist I've ever worked with. So, it really is about service and connection with your clients. That's it. It's that simple. So if there are things that you need to learn along the way, that will manifest itself to you. Your clients will shine the path towards what it is that you need to learn in order to support them in a journey that is truly about them and their healing, where your practice will grow and thrive because you are serving people in integrity. And that is how you will build your business. Uh, that is how prosperity is built. It is not about sales. Uh, so thank you so much for listening. And thank you for bearing with me in my moment of controversy. uh, and I'm looking forward to hearing your opinion and experience, and to building a conversation based on what you have to say and what you have to ask. So thank you so much. And I look forward to hearing from you. Bye.